Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I'm here to give you an overview of OSCE exam. So before moving further, if you have not subscribed to my channel, please subscribe it and press the bell icon to get more video. So in the OSCE exam, you will have the 10 station where you have to pass all the 10 station to be registered in the NMC. And if you have failed in any of the station, then you have to reset for the particular station, not all the station. So first 4 station will be the APIS station. So A means the assessment where you have to do a 2E assessment of the patient. And second station will be the planning station. So you have to identify 2 problems in the assessment station and make the care plan in the planning station. So planning station will be the silent station where you have to write the 2 care plan. And the third station is the implementation station where you have to give the oral medication to the patient. And the fourth station is the evaluation station where you have to give handover to the nurse or doctor or to the psychiatric team, any of based on the scenario. Then you'll have another 4 clinical skill station where you have to perform the clinical skills such as blood glucose monitoring, subcutaneous injection, IM injection. So you can get any of the 4 clinical skill in the clinical skill station. Next station is evidence-based practice station. So in this station you will be given some article and from that article you have to provide information to the patient. So article will be related to some disease condition like diabetes, female myocardial infarction or prevention of pressure ulcer. So based on the scenario or based on the article you have to provide information to the patient. So you don't actually have to provide information to the patient, you have to write in the paper. So this is a silent station. So another station is a professional value station. So this is also one of the silent station. Here you will be given scenario like what you will do if you have given overdose medication to the patient. So you have to write in the paper what will you do if you have made the drug error or what will be your further action. So this is the formula SIP-ILPS. So this will be used in all the station. So before proceeding with your procedure, you have to do all of these things for all the station except the silent station. So first one is here safe to approach. So you have to see for this whether the scene is safe to approach or not. So you have to make sure that the scene is safe, and you have to state that scene is safe for me to approach. In case you have seen some cigarette or any lighter, and if you have seen water in the table of patient but the patient is nearby more, so you have to make it safe. You have to explain the patient that you cannot keep the cigarette, or I'm going to remove the water from you until you are in the nearby mode, and then you have to state that now scene is safe for me to approach. Then second is hand hygiene. So the hand hygiene you have to do in all this station and by using the LF7 step. Then you have to introduce yourself to the patient. You have to tell that my name is Pinky and I'm one of the nurse looking after you today. So you have to tell the name as well as your role. And then you have to ask the patient the preferred name. Like you can tell that how may I address you or what you like to call by. Then you have to do identity check. So identity check should be done in 3 ways. You have to see in the documentation, then you have to ask with the patient, and then you have to see the wristband. So in the identity check you have to see for the name, then date of birth, and then hospital number. But if it is the community setting, then you have to see the address. And then you have to check for the allergy. So you have to ask the patient whether the patient is allergic to any dog or any food, any peanut or anything. And if the patient is allergic to drug, then you have to see the red wristband. And if it is not there, then you have to say that I will give you the red wristband. And then you have to check for the latex allergy, and you have to make sure the patient is comfortable or the patient is having pain. So if the patient will say that I'm having pain, then you have to ask the patient the score of pain. So you have to say that if you have to score from the 0 to 10, where the 0 is no pain and the 10 is worst pain ever, where would you score it? If the patient will say 5, then you have to keep the patient in comfortable position, ask the patient to do the deep breathing exercise, and also you have to tell the patient that if you want medication, then I will check in the medication chart and give you the medication if it is prescribed, and if it is not prescribed, then I will escalate it to the doctor. Communication in OSCE. So communication is important in OSCE. So they are not only assessing your skill, but also they want to know about your communication skill. So it is important to interact with the patient, talk to the patient, continuous explain your action to the patient, speak your thought, confirm name and date of birth or age loudly, build rapport with the patient, and involve the patient in decision making. So suppose if you want the patient to send to the alcoholic team, if the patient is alcoholic, for that you have to ask the patient permission whether the patient want to stop the alcohol or not. If the patient doesn't want to stop the alcohol, you cannot force, you cannot refer to the alcoholic team. If the patient want to stop it, then you have to ask the permission to the patient whether the patient want to meet the alcoholic team. So it is important to involve the patient in decision making. Correcting errors. So if you have done some mistake or error in exam, you can correct it. For example, some waste you had to put in the clinical bin, but you forgot to put in the clinical bin, yellow bin. Instead, you have put in the black bin. So you can correct in the exam that I should have put in the yellow bin. I will not do such a thing in the real scenario or in the hospital during the working. So you can make it correct, and that make a bit different, or that make you to pass in the exam. And then managing now. So you just have to focus on the talk ahead, do your work, avoid or ignore activities or noise around you. Think about teaching the key point instead of explaining over to the patient, because you will get the limited time and they will assess your all the activities within the time, not beyond the time. So you have to manage now in exam. So in the API station, first you have to do the assessment station, which is a 20-minute station. And in this station, you have to communicate with the patient, develop a rapport with the patient, and then you have to do scene safety, hand hygiene, and the introduction with the patient, identity check of the patient, and allergy check, and make sure the patient is comfortable. Then after that, you have to do the ATU assessment, where you have to check the airway, breathing, circulation, disability, and exposure of the patient. And also you have to do the holistic health assessment of the patient, and you have to monitor accurately the vital sign and document it accurately according to the patient condition. You might have the NEWS score or GCS score, and then you have to do the appropriate escalation based on the patient condition. And in the assessment station, you have to identify 2 priority from left to right the care plan in the planning station. The planning station is a 40-minute station where you will be given scenario. The scenario might have been changed. If the patient is in the pre-operative in the assessment station, the patient might be in the post-operative in the planning station. So you have to read scenario carefully, and based on that, you have to write the care plan. During the planning station, you will be given all your paper back which was given in the assessment, like the news chart, GCS, PHQ, MOS chart, whatever you have done in the assessment, and also the scenario paper of the assessment. Everything will be given back in the planning to write the care plan in the planning. So implementation station is a 15-minute station where you have to give medication to the patient safely, and the medication will be the oral medication. Another station is evaluation station, which is 8-minute station, and you have to give handover to the doctor, nurse, or psychiatric team based on the scenario. And in this station, you will be given the scenario and the piece of paper where you can write the key point in the paper, and you can write the S-bar method, like situation, background, recommendation, assessment, and the paper where you will write that will be not assessed. Only the verbal handover will be assessed in the exam. So this is a disease condition of the API station. So you can get any one of these conditions. So the conditions are anxiety, depression, asthma, chronic heart failure, community assessment, ectopic pregnancy, fall and fracture, hernia, homelessness, pneumonia and subdural hematoma. So these two conditions recently added on September 2022. So if you are going to book your exam now, so you might get these two conditions, Alzheimer's disease and end of life. In OSCE exam, you will have the 4 clinical skill station. So you can get any one of the 4 among these clinical skill. So first one is administration of inhaled medication, which is a 12-minute station. Second one is blood glucose monitoring, which is 8 minutes station. Third one is catheter specimen of urine, which is 8-minute station. Fourth one is a fine bore NG tube, which is a 12-minute station. And the fluid balance is also 12-minute station. Then sixth one is in hospital resuscitation is 6-minute station. Intramuscular injection is 12-minute station. And IV floss and BIP score is 12-minute station. Then pain assessment is 6-minute station. Then peak expiratory flow rate is 8-minute station. Pressure area assessment is 8-minute station. Removal of urinary catheter is 8-minute station. Subcutaneous injection is 12-minute station. Midstream urine and the urine analysis is 8-minute station. Wound assessment and the antiseptic non-touch technique is a 21-minute station. So these all skill has added in 2022 in September. So if you are going to book your exam now, so you might get one of these skill. So it is administration of suppository 10-minute station, bowel assessment is 10-minute station, nasopharyngeal suctioning is 8-minute station, nutritional assessment is 8-minute station, oral care plan is 8-minute station, and oxygen therapy is 10-minute station. So evidence-based practice, this is a 10-minute station and this is one of the silent station. So these all are the conditions related to which you will be given article in the exam, and you have to write about the information you will give to the patient. So the first one is honey dressing for the venous leg ulcer, pressure ulcer prevention. Third one is diabetes. Fourth one is a female MI symptom, myocardial infarction symptom, and then smoking cessation. Again, this condition has added in 2022 in September. So again, if you are going to book exam now, you might get one of these conditions. So it's ankle sprain, Asperger's syndrome, bedside handover, cervical screening, Canberra juice and UTI, dementia and music. The professional value station, so this is also one of the silent station and this is a 10-minute station. So these all are the scenario you might get in the professional value scenario. So it's confidentiality, drug error, possible abuse, professional confrontation and social media. Again, these all the scenario is added in September 2022. So again, if you are going to give exam now, you might get one of these scenario. So it's a viewing, concealment of the bed status, false representation, hospital food, impaired performance, laboratory result, racism, witnessed abused. Thank you for watching. Please like to my video and please subscribe to my channel and press the bell icon to get more video. Please keep watching, keep supporting. Thank you.